You know, when you think about your country's health system, it can feel like this massive, complicated maze, right? Super confusing. But what if we looked at it in a totally different way? Imagine it's not a maze at all, but a deliberate architectural plan, a blueprint designed to keep an entire nation healthy. So, let's grab our hard hats and walk through that blueprint together.
So, what is the blueprint for a nation's health, really? I mean, how is it designed? Who's in charge of the whole thing? And how are we, the people living in it, supposed to navigate it all? Let's dive in and figure it out.
Every great building, every skyscraper, every house, it all starts with an architect. And in the world of national health, that lead architect is the government. They're the ones drafting the master plan, overseeing the construction, and making sure the entire structure actually works for its main purpose, keeping its people healthy.
Okay, but why the government? Why are they the ones in charge? Well, it really boils down to three huge things. First, equity, making sure everyone can get services, no matter how much money they have. Second, regulation, setting the rules for quality and safety to protect all of us. And third, cost control, trying to keep the whole thing from becoming ridiculously expensive. It's all about creating a system that's fair, safe, and accessible.
So what's in this architect's toolkit? Well, first up, you've got the real foundational stuff. Funding and building. This means the government is allocating the money, supporting the infrastructure, the actual hospitals and clinics, and providing subsidies to help keep costs down for patients. Sometimes they even own and manage the facilities themselves. It's all about building the financial bedrock for the entire system.
But a building needs more than just a foundation, right? It needs rules. Think of these as the building codes for healthcare. The government is the one issuing licenses to doctors and hospitals, setting the nation's health goals, and constantly monitoring the quality of care to make sure everybody is playing by the same high-standard rulebook. This is how they make sure the structure is safe and effective for everyone inside.
All right, so now we know who the architect is and we know what's in their toolkit. Let's actually explore the building itself. We can think about the different parts of the health system as the floor plan, the different levels and wings you might visit on your journey to getting care.
So this health building, it has 4 main levels. It all starts on the ground floor with community outreach. Think health campaigns or mobile clinics. Then you go up to primary care. This is your first stop, like your family doctor. If you need something more specific, they'll send you up to secondary care to see a specialist, like a cardiologist. And for the really complex, high-tech stuff, you go to the very top floor, tertiary care.
Now here's the crucial part. You can't just hop in the elevator and go straight to the top floor. The system is designed to be a journey. To see a specialist on those higher floors, you almost always need a referral from your primary care doctor. You can think of them as the gatekeeper, making sure you get to the right part of the building for your specific needs so you don't get lost. Okay, so we get the layout inside, but how do you even get into the building? Well, in most countries, you've basically got 2 main entrances to choose from, the public sector and the private sector. And trust me, each one offers a very different experience.
Let's talk about what each of these entrances promises. The public door promises universal access. The whole idea is care for everyone at a much, much lower cost. On the other hand, the private door often promises what feels like a premium experience, maybe higher service quality and definitely shorter waiting times for those who can pay for it.
But of course, every choice has a trade-off, doesn't it? That public entrance, while accessible, can often lead to really long lines and might struggle with underfunding. And the private entrance? Well, it can be super fast, but it comes with a high price tag that just isn't an option for a lot of people. Plus, its focus is on profit, which can sometimes create very different priorities. There's really no perfect choice here, just a complicated balancing act.
So far, we've focused on the architect and the building. But a health system is so much more than that, right? It's a living, breathing structure. It's run by a whole crew of people, and it's constantly in need of maintenance and upgrades. So let's look at the full crew and some of the big renovations our health blueprint desperately needs.
And wow, it takes a whole crew to keep this system running. It's not just the government architects and the healthcare providers on the ground. You've got us, the patients, whose experiences can shape policy. You have insurance companies managing the financial risk, and you've got NGOs that often step in to fill critical gaps. It's this complex collaboration and, sometimes, a bit of a tug of war, where every single piece is essential.
But even the best blueprint can develop cracks over time. Society changes, new challenges pop up, and pretty soon, that great building is in serious need of some renovations. So, what are the biggest structural problems facing our health blueprint today?
The first major renovation needed is to fix a fundamental flaw in the design. the huge gap between urban and rural areas. Far too often, people in big cities have access to amazing, state-of-the-art facilities, while folks out in the country are struggling with really limited services and resources. Bridging this gap is a massive architectural challenge.
Next up, we have a major staffing problem. I mean, you can have the most perfectly designed building in the world, but it's totally useless without a skilled crew to run it. There's a critical shortage of doctors, nurses, and technicians, which leads to burnout for the staff we do have and huge gaps in care for patients. This isn't just a crack in the wall, it's a real structural risk.
And finally, there's the really tricky challenge of political influence. When big decisions about funding and long-term health priorities are swayed by short-term political wins, it can really compromise the integrity of the whole system. It's like trying to change the blueprint halfway through construction. You risk the stability of the entire building.
So we've walked through the whole blueprint, from the architect's vision to the floor plan of the building and the urgent renovations it needs. And all of this brings us to a final, really important question for you to think about. If you were the architect, if you were in charge of your nation's health, looking at all these challenges and choices, what is the very first thing you would change?